You feel like it, that we continue doing a different massage, something else. In this case, we are going to work on plugged ears, which happens a lot. For example, many patients in this case, there are many patients who come because they have had ear plugging, because they have been brought water, for example, in the swimming pool, of people who, for example, in fact myself, for example, on a flight last summer, where when I visited Edinburgh, I realized that my ears were blocked and I experienced a sensation of phlegm in my ear. I also noticed the presence of mucus in my nose, similar to what one might experience with a cold. Can you inform me of the definition of phlegm? Sometimes I don't hear well on this side, or my ear bothers me a little bit, or I don't touch some movement. I say, oops, it does this here, as if there was something, right? As if there was something in there. And in fact, on the trip, when we got off, my ear started to hurt a lot. My ear started to hurt a lot. My ear started to hurt, and from then on, I started to say, hey, I'm going to have to work on my ear because this is not normal. It is not normal. My ear is very clogged, and there is one ear that is much more clogged than the other. I have to start working on it. So we're going to start doing some things for the ear, and it is going to be very useful for you. And it will be very useful for you. There are many people who have blocked ears, even if they don't even know it, who suddenly have ear pain from time to time, who have a cold and the ear hurts more than usual too. And that he has mucus, and as soon as he has mucus, he starts to have pain in this part, in this area here, that goes to the throat, but the ear also starts to ache immediately, right? That is to say, there are very interesting things to work on, right? Well, we start working with the ear. So we start working with the ear because in the end, look, wait a minute. Let's work on it a little bit. I don't know if you have ear problems. Have you ever had? You see, I really don't know. But one of the things that can be pretty common and quite significant sometimes is the accumulation of cerumen in the ear, right? It happens frequently that we find cerumen in our ears and it accumulates, and that's why we have that phlegm sensation, right? And sometimes we have that phlegm sensation. Well, plugged ears can also be allergies, inflammation. I am going to give you a little advice at the end for the inflammation issue that you can take something, okay? Well, let's get on with it then. First of all, okay? From the plugged ears, we're going to massage the area of the tragus, okay? And the tragus, you'll think it's here because it's the tragus. No, the tragus is here, right? It's important. This part here, okay? You're asking me, let's see. Okay? If you know anyone who needs, for example, this kind of massage case, who has clogged ears because they always tell me I don't know what, that their ear hurts or that their throat hurts and then it goes to their ear, or that they are always constipated and have such and such, share this video. I tell him, hey, look, watch this video. It will come in handy. At the end, we are working on health at home. That is, you can do this at home. It is better than impossible. You do not have to say, I am going to the doctor to see if he will tell me that my ear is always like this. Well, you can do it from here, right? Well, let's start with this. The tragus, look, the tragus is this part of the ear, okay? This part here, I mean, what covers the ear, let's say, we're talking about the ear. The ear is on the inside. The ear is on the outside. So if we do this, I can't hear you well anymore. We are here, in fact, try it a little bit here. The movement. See if you notice anything strange. In one ear or the other, soft. Or just, well, I don't know, you stop hearing, you stop passing air, okay? So, how are we going to do the swallowing massage? It's the protuberance of the ear canal, right? Thumb and forefinger we grab, okay? The tragus of each ear, thumb and forefinger. Okay? Here. And we're going to start moving it back and forth. Nothing. A very simple exercise, right? For a minute, right? Right here. And once we're doing this, we're going to make little circles. Up and down. Circular motion. Come on, follow me here. Super simple. I don't have to ask for a handshake, I just have to grab. Okay? And now we switch to the other side, okay? Let's go on a little more. Okay? Perfect. Surely you don't have a little bit to relax. There is a little movement, right? I mean, blood movement as well. And we relax the muscles around the ear, huh? That is why we do this work first, right? The second one we are going to do is a massage in the mastoid area, in the back part, right? It's going to be a little bit in the area. The occipital is a little bit more here, right? But we work a little bit in the area of the occipital nerve approximately. Now, what part are we going to start with? Well, look here. If you notice, behind the ear we have the bone, right? All this bone, right? Well, we are going to do it a little bit on the bone, so we are not going to press too much. It is going to be a gentle exercise, but there is going to be a route, right? Right? So how do we do the exercise in principle? Right? We put our fingers behind our ears, right? Both of us. Okay? I'm going to place them here. And we're going to do an upward sweep, okay? In semicircles, like every 2 minutes. Look, I think this might help you, huh? I believe this can be of assistance to you, right? I always strive to consider those of you who are currently at home in order to provide support. Take a moment to review the path that this channel is currently following. It may offer valuable insights. Okay? Do you see it a little bit here, this channel? Well, we are going to do a little bit of this same route, right? Right? Here. The red one. There. You can't see this one here, but I think you can see it here. The red, okay? Okay, and from here we are going to start doing it, okay? 2 little fingers at first. Put the egg, which we're going to work with later, by the way, under the ovum. Be careful here, because this point, apart from the fact that it is used for pain molars, is a point that can bother you a little. So without squeezing, and as there is displacement, whenever there is displacement, a little bit of cream is not bad, eh? Cream or oil, okay? I remember this phrase I said, which seems very silly, but it is important whenever there is displacement. A little bit of cream, right? So we come here, okay? We're off the bone, but we're going to go to the bone and over the top, okay? And we're going to go all the way up to there, huh? Let's say up to the propeller, a little bit here, over here, more or less. The tip of the propeller, over there, more or less. Okay, I come over here and I'm massaging upwards, and here we stop, okay? We keep the massage in place a little bit. Notice that they move up to the temples, huh? And here I can press a little bit more because it is more comfortable, but if not, here, right? I'm massaging here. I'm more or less at the level of the bone, right? We go on. And when I get here, I do 5 times here. 3, 5. I come back. There. Here are semicircles with displacement. We go back, we're going to repeat 10 times. Okay? I place myself here, you know how it is. Perfect, it also relaxes. Especially there, we get to the gallbladder channel. We go down and up again. In fact, the gallbladder channel one has to do a little bit at the end with the anger that one has. In other words, if we let this go, I'm sure we're doing better. There we go. And we come back, okay? We continue a little bit here. Remember, movement and up. Loosely? It has to be loosely because we're almost on the bone, huh? So loosely, here. We can squeeze a little bit more, increase the intensity a little bit without displacement in this case. There. And again. You can do it here, eh? If you are lying down at home, no problem, eh? You come here. Be careful, of course. Here with the sternocroton study, which will go out a little bit, but here, right? Here. Come on, you're at home quietly. Without, that's it. Three last ones, huh? Come on, join me here. Here. So up you go. I didn't tell you when we do this. Recommendation for me to do it. For me, recommendation in the evening. Recommendation in the evening. Well, why at night? Well, in principle at night, because sometimes if we have a little buzzing, for example, it will help us to reduce the buzzing a little bit. And it is true that the buzzing usually occurs when there is more silence. When there is more silence, it is at night. When you wake up in the morning, take a moment to appreciate the small things in life. If you have functioning ears and a sense of responsibility, make the most of your morning. Remember, every decision you make at that time sets the tone for the rest of your day. You what suits you best. But normally I recommend doing it in the evening to release, to let go, so that it can be a little bit better. If in the morning you feel like that, well, go ahead. In the morning too. Come on, in the morning too, okay? Let's go to the next one. In this case, it's a very simple massage, okay? We've been working on this whole part here, okay? To begin, we will commence working by engaging in a brief stretching routine. Prior to that, I propose we perform an earlobe massage, a practice familiar to us all. Are we in agreement? In fact, in auricular therapy, right? I'm telling you so that you know a little bit that auricular therapy works a little bit with the ear, like it's a baby. Okay? And in auricular therapy, the baby's head, in quotes, the baby's head, okay? But it would be this. Okay? I mean, this whole part, okay? Here, on the earlobe. What we are going to do is to take this little point further down. Here there is a point that also works very well on the subject of anxiety. But what we are going to do, what we are working on here above all, is to open up a little bit. That is to say, to extend this part a little bit, okay? So first we are going to relax, and then we are going to pull. Okay, then we're going to, right? I mean, imagine this at night, which also relaxes you, and on top of that, you relax, and on top of that, you lower the stools a little, and if there is inflammation, it also lowers a little bit, right? You can do both at the same time. If we divide this into 6, which is how it should be, okay? Roughly, I'm going to the end and a little bit out, okay? And I'm going to work there. Okay, I repeat at the end, like at the tip, and a little bit out, not inward but outward. And I'm going to start working there, both of them, okay? We massage a little bit. And once I've massaged a little bit, I start with the actual exercise, okay? Which is start pulling back. Okay? Laughs. You can do it back and forth. Watch my head, it's going Here, here. Okay, you don't have to go all the way down, but you can just pull down here to open up. I don't know if you've seen these exercises before because we actually have videos done on our networks. Okay? So I advise you and I encourage you above all to look for them, to do the exercises and to share them because we also have exercises. As a solution to reduce your double chin, we primarily recommend enhancing your Eugenian Cronus exercise and alleviating the appearance of bags under your eyes. These methods are highly beneficial. Moreover, they are effective in minimizing forehead lines, marionette lines, and crow's feet as well. Through exercises, massages, and facial yoga, we undertake a thorough approach to address these concerns. In conclusion, incorporating facial yoga and massages is crucial to achieving favorable results. To do these exercises, okay? We're done with this one, okay? We've done here, we've opened up a little bit, okay? Like we were doing. Look at all the notes I've already given you. Everything I've told you. Okay? This in principle, what are we going to use this exercise for? To relieve internal pressure, right? Inside the ear. And to improve the flow of the inner ear as well. I mean, it's funny that we do something external to do something internal, but that's the way it is. It's always like that. Or almost always, huh? It is almost always like that. We continue. Come on, let's see. Look, the massage I was telling you about the cartilage, right? In the end, it is this part that is not bone, right? What are we going to do? To stimulate nerves, relax the tension a little bit, okay? We're going to do it from here up, okay? And then we're going to stretch. All right? Okay, come on, let's do it. See, I'll start from here. Here with 2 little fingers. You can do it with more fingers, huh? But in principle, 2 little fingers and I'm stretching. And we're ready, right? Back to an exercise that I love. And that also appears in the videos. In the video, in this case, I think we have it in the tinnitus video. You can look it up. It is one that I really like. And also, here you will notice if your ear is blocked or not, huh? Let's do this and then I'll tell you about it. Come on, let's do it. The little fingers. You can do it with all of them, huh? Let's continue. Obviously in both ears, huh? I'll put it in the other ear too, huh? You've seen that I'm pulling a little bit to test that sensation and do that sensation that I was doing here, but in the whole ear, huh? Okay. Perfect, okay? Okay. Let's go to this exercise that I really like, okay? It's to work the lymphatic system a little bit too. Okay? First ganglion hip 2, okay? Right here. And look, let's do this. Somebody, I don't know if you know a little bit what this is or if it rings a bell from a movie or something. I don't know. It's not an any-cut or anything like that. It's something else. I don't know. Well, this is a bit geeky, huh? I'm telling a little bit. I don't know if any of you know it or not. But there's a Star Trek movie where, well, it's the greeting. I try to see if you can do this. Sometimes you can't. It's not so easy to do this with your hand. This, yes. This too, but this is more difficult, eh? Well, you can do it. That is what we are going to do now. So, come on, let's do this. We're going to decongest a little bit. Mobilize, okay? Let's put it here, look. Right there, okay? Not here on top, but right below, but like I'm standing, like I'm looking, right? Like the thinker a little bit. Well, the thinker is actually like this, right? The thinker. Have you seen it? It's beautiful, the thinker. So that would be here. Right? And without a lot of displacement, I mean, no, now I'm not stretching the skin. I don't have to make the skin move a lot or be like this. I'm not doing a massage as such, huh? Right? I'm doing a little bit of drainage, okay? And touching this part of the neck as well, huh? We're going up and down, just a little displacement. First, about 20 times. And I want you to notice one thing while you're doing this exercise. I'll be quiet now, but you watch now. If there's something moving inside the ear, huh? If there's something happening inside the ear, okay, we switch to the other side as well. Remember here, Star Trek. Okay, I take this one out here. Less in the face, more towards the neck, okay? See how I'm taking all this part. Here where the ear ends. We go up a little bit more. Tell me now when you're done. See if you notice anything in the ear too, in the movement. Okay, perfect. And besides, why did we do this exercise as well? First, to notice if we have any inflammation. Why? Sometimes it also happens that we have some inflammation in the part of the obstacle tubes. The obstacle tubes, not others, eh? So, if it produces an inflammation inside, okay? It may be that you have justice, that you have allergy. The allergy at the end is also, it produces an inflammation too, right? So, when someone eats something that, for example, has an allergy, it comes out, and in addition, it comes out on the skin. So this exercise is also good to see what happens inside the ear. If it moves, if it can be more. That is that it may happen more often, or that there is a part of the ear that you have it. Oh, let's say more prone, that's the word I wanted to use, more prone to this happening to you. In other words, you have to work more on this ear, you have to work more on the other ear. That is why it is important, right? Well, let's finish in principle. Let's finish in principle with one point, okay? And then you can ask me any questions you may have, right? Well, let's see. Let's look at the point we have here. Look, this point that you see, yellow here. Let's see. Yes, because it would be. Well, this one actually. Let's put the red one. Let's put the red one. Look, it's the dot that's in the ear, okay? Red line here. That's the watermelon or kaiksin. That's the dot. We are going to work on it now, and you are going to notice it too, eh? It is a point with which you have to be careful when working. Because if not, it can hurt a little. It is also a point that will help. Because in this case, if you have some bruxism, right? if you are also interested in the topic of bruxism, do you want us to do a massage one day? A massage, you want us to do some points? Tell me about it. Also look at the website. We have videos too, right? To see all these topics about bruxism, about this pain, the mesotero, that sometimes prevents me from sleeping, that if I wear a cell that wakes me up, that I have stress, because it has to do with stress. Hey, we also have a lot of videos to help you sleep better, to reduce anxiety. We have videos, and if you want us to do it too, okay? An online session, even with me on the web, we can accomplish this. Ruben, I need to chat with you regarding something that is happening to me. I'd appreciate it if I could get a massage from you. I would like you to observe me and communicate directly from this location. And be able to say, look, come on, we are going to see each other. We are going to see each other. I am going to see how you are. And I'm going to say, let's see, move this, let's see, move that. What's wrong with you? How are you? And then we have a face-to-face and a personalized session directly with you, okay? We can do that too. So that's what we're here for, to help you solve and to make you feel better and well. You know that until the healing. Okay? So let's get to the point. This is what we said was the drink, okay? If you open your mouth, see, if I stand in the middle of the drink, something goes up, right? Your finger goes up, look. You feel it, you see it, don't you? And if it doesn't go up, you have to put it so that it goes up. Here's one and here's another, right? If this one goes up, let's lower it a little more. Right? Here. There, okay? When you open your mouth, the finger will move. Right? Notice that this is the swallow. I'm like in the middle. It's a little bit lower. Right? There. It moves. When I do this, it moves. Look for it. If you have any trouble finding it, tell me that too. And in principle, mouth not completely closed, but normal. That is not open. Here. Pulling inwards, that is not outwards, but inwards. Though be careful with the pressure. It doesn't have to be a very strong pressure because you can feel it immediately. But here, right? On the other side, the same. And we work, huh? Inward a little bit. Semicircles. To one side first. And then the other side. Right? This is the stitch that we said, the stitch that goes great, okay? The XX, a triple warmer. Notice that the point is called Herman or ear door. That tells you everything. So these have been in principle the exercises, right? The massages, the points. You know that here we work everything in a very global way. Also in a holistic way to try to help you from here to there, but we are next door. Right? If you have any doubt, put it here. Write me. Tell me. Hey, look, I have not found the point. What is it? 60S, triple heater, such and such. Whatever. Please remember that similar to what we are currently doing, there is also the option of online dating. However, if you prefer to meet in person, I would like to request a massage session with you. I would appreciate it if you could demonstrate it to me directly, as I am unsure about the technique at the moment. I don't fully understand what to do in this situation. If you have any questions, feel free to ask me. You can ask me, you can tell me, you can ask for online appointments, get on the web, review videos. We are here to help you. That's why we made this channel. To be with you, to solve your problems, to make your life easier, and as always, if I tell you, to healing and beyond.